In this demonstration, I'm going to show you how you can use Inca Clinic in areas outside of travel medicine. It may be occupational health, it may be mini medical or health checks that you might run through your clinic or pharmacy. What I'm going to do is I'm going to start off by booking a patient in. Let's imagine that they've rung in on your call center line. I'm going to choose that they're going to come in for a mini health assessment, and you can see it's going to send out a confirmation email along those lines to the patient. So I'm just going to put in a patient information, and I'm going to go ahead and save that appointment for this patient. What has happened is the patient will have received a confirmation email, and if I click on that, it has a link, and the patient can go ahead, click on that unique link, give them some information about their appointment, and then just ask them to fill out some additional information such as date of birth and so on. Once I've entered all the required fields, I just click Next. And here I have a questionnaire that they can fill out online to give us a head start on the assessment. Back in Inca Clinic now, if I just refresh the Appointments tab and open up that diary, I can see now that that patient has now booked in. And at this point, I don't know if there's an existing patient or not, so I'm just going to go ahead and check that using the Convert or Link to Patient button. What this does is we'll just check Inca Clinic to see if there's a matching record. In this case, there isn't. So I'm going to go ahead and create a new patient. As you can see, it's already filled in all the required fields, so there's no additional information that I have to add in, so I'll just go ahead and save that patient. Now I'm going to start my consultation, and I know this patient has booked in for a mini health assessment, so I'm just going to start that consultation here. And over here, I'm going to open up the assessment form for a mini health assessment. So this is linked to this particular care pathway. So I can design different questionnaires to different types of consultations. As you can see, I've broken it into different groupings to capture the type of information that I want for this particular type of service. So I'm just going to go ahead and enter some information about this patient. Before I do that, I'm just going to go and check what the patient filled out online. So I now have his doctor's address details, and it seems that the patient is in good health generally, and of course I could have asked more questions on that if I wanted to. So let's go ahead and fill out some information about this patient. We've already taken some measurements at this stage, so we'll enter them in here. You can see that his BMI is slightly raised, so we might want to record that against the patient's assessment form. However, if we found this patient was significantly overweight, I could go ahead and actually enter in a specific medical term. So rather than just recording it against the report, I can actually use a proper classification. So behind the scenes, you can use ICD-10 codes or whatever classification systems you use and save that against the patient's official medical record. And over time, if that changes, I can say, well, this is no longer an issue, so I can deactivate it. I can put in notes, or I can put in, if he loses some weight, we can record that as well. In this case, the patient's just a little bit overweight, so we'll just record that as is and go ahead with the rest of the assessment. So I'll very quickly fill out the other information as we consult with the patient. Down here, I've created a section specifically to do with cardiac health. So we're going to ask, is there any family history? And maybe the patient has said, yes, there is. So we can enter some information on that. Maybe his father had some heart conditions. We're going to take his blood pressure, and we see that it's pretty normal, so that's fine. We'll just record that in. And again, if he had high blood pressure, we could go in and record a specific term of hypertension or whatever was appropriate for that particular patient. These last forms are just free text entry, so I'm going to put in his heart rate, and we've also taken some cholesterol readings as well from maybe a previous consultation or some other information that's been provided to us. So we're going to put those readings in. You can see that from this that it's slightly raised cholesterol, so his overall cholesterol is a little bit high. It's kind of borderline, so we may want to give him some advice on that. Or if we found that these readings were on the wrong end of measurements and his overall cholesterol was too high, again, we could record that as a specific medical condition as well. But overall, the patient seems reasonably fit and healthy, and we're just going to go ahead and we're going to save that assessment. So that is now saved as part of that patient's medical record. Again, if this was, say, an occupational health assessment, pre-employment medical, and there was a requirement around this patient having hepatitis B, for example, we could go ahead and choose one of those vaccines. We could choose a course of Endurex, put in the appropriate course, and then go ahead and administer that to the patient. And again, if this was on behalf of a company, you can provide a report and information on their vaccine status and cover if that was appropriate. Go ahead and administer the recording of that vaccine. And finally, in this, I have an option to record lab tests. So I could go ahead and order other types of tests. I might want to do a full blood count, maybe redo the cholesterol test again, or whatever is appropriate for this particular healthcare setting. Once I'm happy with that, I'm going to go ahead and finish this consultation. And that's my assessment done for this patient. I could go ahead and invoice them for this particular service and continue on with the rest of the day. Or I can go back into the patient's record and just have a look and see how that updated. And you can see now here there's a health assessment has been created for this patient, and I can go in, if I click through there, I can go in and review the results of that assessment and share it with the appropriate people, maybe it's GP or some other service provider. So that's just a quick overview of how using Clinic in a non-travel context, and I hope you found it useful. Thanks.